Now let's talk about mental health. Ghana records 1,500 deaths per annum through suicide, with 35% being students. A research conducted by the Mental Health Authority reveals an alarming shift in victims from adults to youth and children. Briefing the press on the commemoration of World Mental Health Day, Chief Executive of the Mental Health Authority, Dr. Akwesi mentioned public education in schools and the introduction of an active guidance and counseling system as some of the measures put in place to resolve the issue.
Focus on suicide and its prevention by the mental health fraternity worldwide speaks volumes for mental health as a public health crisis that is manifesting through suicide. What makes the phenomenon of suicide more crucial is the fact that victims of suicide these days are mostly the youth and even more worrying, children. In the past, if you heard of anybody committing suicide or having attempted or tried suicide, that was probably an elderly person, at least somebody in the 50s, 60s, and mostly men. These days, we are seeing a reversal of the data. Much younger people and even more women than men. It is often believed that it is only adults who exhibit suicidal behaviors, but it should be made known that many children and young people engage in this phenomenon as a result of violence, sexual abuse, bullying, and cyberbullying, among other factors. Suicidal behavior has existed throughout human history, but due to several complex factors, it has increased gradually in all parts of the world, and in the past few decades, it's been climaxing and it's received alarming statistical levels. The WHO puts the figure of people who die by suicide a year at more than 800,000, making it the principal cause of death among people 15 to 29 years old. For a breakdown, every 40 seconds, the world loses somebody through suicide. There are some measures we have now. For instance, this media encounter, public education, and we need to embark on it more. Public education is not enough. You want to go to the schools. The schools have a school health education program. You want to be part of the school health education program. And also the universities in particular, they have guidance counseling centers. We want to beef up the counseling centers so that the impact will be there and we'll be able to give preventive and promotive education to them. So these are some of the measures we are giving. Then also, people who attempt suicide and are brought to us, we want to speedily respond to them, spread mental health services to the regions. Now you don't need to go to Accra and Kafro Pantan alone to have your mental health care taken care of. So in the regions, in the regional capitals, all the regional hospitals have psychiatric wings. We have also extended mental health services to the districts. We have community mental health workers all over, and these are all measures to keep the incidence. I agree that is not enough. You need to beef it up and train more mental health personnel. We have also some training programs that are dedicated to people who, like recently you've opened toll-free line. Unfortunately, the toll-free line, only one center, one telecommunication network has agreed to provide the toll-free line. Even they is subject to your calling from their line. But we are discussing further to see that we will be able to give the toll-free line, spread it, so you can quickly call and get your support. That short time somebody attempts suicide or somebody is in distress is very crucial. If you can tackle that, that go along with you. So these are some of the measures.
There's a lot that can happen in that split second. I have here in the studio Favor Hilda Apini Brown. She leads the Favor Foundation for Life, an NGO targeted at raising awareness on suicide prevention. Well, this year's Mental Health Day focuses on suicide prevention. So Hilda will help us talk us through suicide as you take some notes from it. Hilda, you're welcome to the show.
Thank you.
Now, you listen to Dr. Akwesi say he's been doing this, he's been at mental health for years in this country. He looks aging as well. But when you listen to the interventions that he says that are being put in place, does it suffice for you? Is it enough for you?
Yeah. All he's mentioned are just very critical things that needs to be done immediately. It's like we draw most of the plans, but the action is what is, lacking. And then I would want to add that our mental health facilities needs a lot of improvement. Government has to come in, and civil society should also help in improving the situation at the mental health facility. Because if I am depressed or I am suicidal and you take me to such a facility, you might even worsen my situation. Our mental health facilities these days look more like prisons, not a facility that should be welcoming. If you enter a mental health facility, you should feel that this is, better than my home.
Okay.
But it is worse than, our homes, and that is unacceptable. So like the interventions that he mentioned, the education is very important. The young ones need to have guidance and counseling. It shouldn't be us waiting for the children to get into depression before they come. It should be proactive.
Okay.
Yes.
And from those, he says that 35% of those who are committing suicide are actually students.
Yes.
Which means they're young, they're studying. From your interaction with people through your NGO, what is eating up? What is it really that's eating up young people?
So many things. For young people, most of them are relationship issues. Some have, even though they are young, yes, they tell you, this is the girl I met and we've been in relationship for a year or two, and she says we should stop and I am not ready to let it go. Then some of them are also parental pressure. They have been forced to do courses that they don't have the strength to, or they don't even have any interest in. And that is putting so much pressure on them. So they feel that, if my mom cannot accept the fact that I can't do this course, then why do I even leave? This is an appeal we are appealing to parents. Let your child pick a course that he or she is interested in. Then drug abuse. Tramadol has caused a lot of mess, and we need to, track it and clamp it down before it destroys our youth. Drug abuse has become a very serious problem. And some of the recent one we noticed is even toffee. This milk candy, they've been able to put some tramadol in it, and they just suck it, and then, the person goes off. Yes, they are high. And
let's talk about parents who are perhaps unknowingly depressing their children. What are the signs, if we are to help these parents, what are some of the things they should look out for? I mean, every parent wants the best for their child or their children. So no parents would want to unnecessarily pressure them. But what they do is because they want their children to push further. What are some of the signs that parents should pick up if their kids are becoming depressed based on their own pressure?
Good. Some of the signs you would notice as a parent is your child withdrawing. A child that would normally come to you to ask all the questions begins to, coil back, because he's seeking all the advices rather from friends, because he feels that you would not listen to him. You are seeking just your interests or getting him to do a course that will give you some prestige or something. So if you see your child withdrawing, you should draw closer and find out what are the reasons. Then before you select a course for your child, you should be able to study the child and know what are the interests that the child has in life. What makes the child happy? That should come first, not your interest. You can encourage your child that I think that if you pick this or that, but if the child is insistent that, mommy, daddy, this is what I want, please allow the child to take that. Because interest is even very important in pursuing a career. If I don't have the interest, you push me, at the end of the day, I might not even, succeed in it. I'll be doing it to please you. And when you push the child to the wall, then that is when depression sets in.
Are there specific words? If there's anything else you want to add, please go ahead.
Yes, I wanted to also add that take the child to a career guidance, consultant. We have so many of them now in various schools. And let the child be able to know that if I pursue this course at the SHS level, this is what I can do at the university. Because some of them select courses that do not match up to what they would want to pursue in future. Then they end up getting confused and pressured to do things that, courses that they didn't want because they didn't know. So don't let your child be ignorant at the beginning. Let the child know that, for me, I have started right from even the primary. I have educated them. If you pursue this, this is what you would do. And if you want to become this in future, then these are the courses. Yes. So as the child is growing, you should be able to monitor to know. Sometimes the child's interest might even change
as they grow. I mean, several of us have had our choices change. I wanted to be a newscaster from beginning,
right?
So I knew it, but there are several things that you have to battle with, even as an adult, to make a choice.
Perfect.
There are so many things that you need to battle. What kind of language should you be wary of when your child or when young people around you begin to talk, begin to speak? So I spoke to a young person over the weekend, and she said, Daddy's expectations are so high. And I mean, I try to convince her, let her understand that if they're high, it's because he wants the best for you. And if you feel they're too high, look for your own standards, but you know, and try. What sort of language should you be wary of when your child or young people around you begin to speak?
When they begin to speak, you should don't do active listening. Don't just listen and pick what you want to listen. Listen to what is sensitive to them. They would pinpoint exactly what they want and what they do not want. But most of the time, because parents already have, this is the way I have crafted for my child. Even when the child is saying something opposite, they would want to force the child to, you know, toe that line. So as soon as the child makes you realize that, no, I am not comfortable with this, or what you are asking me to do is too high for me, let the child know that, no,
you are free to do what you
want to do. Then the child will be comfortable to do it. And in the end, you will see that it would all turn out good, because he or she is the one going through it. You have made your choices, and you are here. Let her make her choices too, you know, and life would be much better for them. Because they go out there and then they have their own personal dreams. And so you have added, so the pressure really is like, you know, so where do I, you know, fit in?
Well, what is the Favor Foundation doing on the World Mental Health Day?
For us, we have decided that it's not even going to be just a day affair, because we've realized that over the years, we just wait when it's Mental Health Day, we come and say all the things, and then that is done. We have drawn a year program. So even though this year is this day is an highlighted one that we go through the media and all that, we have programs running through all the regions of Ghana. As I speak, we have people organizing programs in Navrongo, Volta region, they are also having their programs. Kumasi is ongoing, and we've collaborated even with the GPA. I am a member of GPA, Ghana Psychological Council. Association, and we have a whole lot of programs going on. And this morning on our platform, we were all clapping for each other, because it's like we are becoming what we were supposed to be years back. And we have become, you know, very aggressive in addressing mental health problems of the country, because with mental health, prevention is key.
Great.
Yeah.
Great. Most importantly, helping these people, reaching out to these people is priceless, especially when you have a personal story to share. And Favor like here has a personal story to share. And if you haven't heard her story, she tried to commit suicide. How many times was that?
For the attempt, it was just once, but the thoughts were several uncountable because of the depression, that I was going through at the time. So she's done it, and she is out there reaching out to people who need such help. Let me take your final words, Favor, as we wrap up. My final words to anyone going through suicidal ideation today is that there is no situation in this life that is ever permanent. Whatever you are going through now is just a phase. And just like the book, you've opened just a page. You have to wait to see what the next page have for you. You don't have to end it when, you know, God himself has not closed the cover, because you didn't bring yourself here. Someone brought you, and there's something definitely better. That is why he has still allowed you to be here. Never ever think that suicide is a solution to any problem in this life. If I am alive today after 10 years of having suicidal ideation, then I can tell you that it was a big mistake I nearly made. And I thank God today I didn't make it. And I expect you not to make that mistake too. Let's all live. Let's support each other. If you have someone that has suicidal ideation, just call us. Favor Foundation for Life, we are worldwide, ready to reach out to anyone, anywhere in Ghana, at any time of the day. You just call us, and then we'll be ready to help you. And let's stop the stigma. Please.
Okay.
Mental health affects anyone. Today it's me. Tomorrow it might be you. Stop
Okay.
stigmatizing it.
And stigmatization is one of the biggest problems that we have to deal with when it comes to mental health. We need to be open. We need to allow people. And for the parents who are giving your children too much pressure to be what you want them to be, allow them. This is life. And if you're any of those kids, do not worry. Do what you want to do. Do what you want. As long as it's not wrong, do what you want to do and you'll be fine. So people can find you on social media, Favor Foundation for Life, on social media, Facebook, Twitter, Instagram.
Our website is Favor Foundation for Life, fflghana.org.
Just Google Favor Foundation for Life and you'll be fine. But the number you wanted to put across for
026 55 96 722. If you can't even call us, just send a text or flash.
Okay.
We'll
so
call
with
you
this
back.
number, if you have anybody who you suspect is having suicidal thoughts, or if you yourself are having suicidal thoughts, you can call this number and they will have people to talk to you and help you understand they've been there too. So the number again is 026 55 96 722. That's 026 55 96 722. I hope that this saves somebody today. Favor, thank you for coming.
Thank you very much for having me.
Favor Hilda Apini Brown. She's the founder of Favor Foundation for Life. They talk to people about mental health, and especially people who are suicidal.